Hello, everybody. Mark Rogers here. It is good to see everybody today. We're winding down through November already. It's Veterans Day. Wanted to say hi to everybody. We are in the middle of our Medicare season here. Lots of things happening, and I can't do the program without Leith. Leith, thanks for jumping on today.
Hi, Mark. It's a beautiful day out at Leith.
It's a beautiful. Yeah, in fact, I wanted to show this little picture, right? There's the work that I've got to do. The leaves are going to keep coming down, and I've got to take care of all the leaves. And I've got a backyard that's got leaves too. Anybody that's knows what the fall is about, this is the time where you have tarps upon tarps of leaves. Tarps of leaves.
We love our trees. We love our trees in the Northwest.
Absolutely. And for those of us, like I'm over on the east side, we love our leafy trees in the summertime because of all the heat. Yeah, it's a big deal. Yeah. So anyway, we got lots of things to talk about today. And so we're going to really quickly, we didn't find any hot news to share today, folks. So we wanted to just move on into, there are strategic things that you can do right now during this time. And we wanted to share what those things are in a brief section. We're serving Washington State. We love our Washington State. Much problems that have Oregon, rural retirees in Oregon as well, even a little bit of Idaho. There's retirees everywhere that we would love to talk about. So remember, Leith and I are available for questions along the way. But everybody needs to be educated. Why is it such an important time right now? Four reasons. Number one, you're able to switch from original Medicare to a Medicare Advantage plan. If you find that you want to get in the Medicare Advantage game, now's the time to do it up through December 7th. Now, you may be, number two, maybe you're on a Medicare Advantage plan and you wish to switch back to original Medicare. Now's the time to do it. Leith, I've had some calls come in, and that's exactly what they want to do. They're seeing where things are going, and we've been talking about it, haven't we? We've been talking about Medicare Advantage and the difficulties presented, and we did this in previous programs.
Things are changing with the Medicare Advantage. Providers are pulling out of areas and not contracting with doctors or hospitals. It creates a problem for people.
And people are just tired of the surprises. When we're in retirement, the last thing we want is all this surprise. We get the mail coming in. It's like, oh, this is changing again.
It's like you're cruising along, planning your trip to get out of the rainy Pacific Northwest and go to Arizona, and you get this thing in the mail. Oh, you got to change plans. And so I guess we're not leaving right now.
Exactly. You got it. December 7th. Yeah. December 7th is when that is.
Got to get it done. If you want to change, you've got to get it done now.
And that's why we're a believer of number four, or actually you can change from Medicare Advantage plan to another, like a Medicare supplement. We're going to talk about that here in just a second. And right now is the time to switch up and look at your Medicare Part D cards. So let's talk about Medigap plans, because we're seeing a resurgence of this here in the country. And let's talk about a Medigap plan. Why do people? So Leith, take us through why hey, listen, I'm speaking to you, right? Was it 2 years ago you switched from a Medicare Advantage plan to a Medigap plan?
Yeah, I was on a great group Medicare Advantage plan from a previous employer, but the fact remained is that doctors in my area would come on and off the plan, and I have to find another one and drive 20 or 30 miles away. And it was like, geez, I was just tired of it. Called up my good friend Mark and said, I'm changing.
It took 4 phone calls.
I've been in the business for how long? And it was like, I was like, oh, I don't know if I'm doing the right things, which really just cemented for me is the questions people have. I went through the process. I had questions that needed answered. So it can be confusing. It can be not confusing. Mark and I are big proponents of the Medigap supplement policy in addition to your original Medicare if you're wanting to get out of the MAPD plan. It's not that difficult to do. There's just steps you need to take to do it.
And Leith, the three things that we find is people want to limit their financial out-of-pocket expenses, right? A Medigap
right.
plan may be a little bit more on a monthly basis, but for all those surprise expenses that may come up, it's going to cap that, and there's not any surprises on that
Right.
on those incurred expenses.
Exactly.
What we're seeing here is this thing here too, with regards to the freedom of no networks, right? Any network that taking Medicare will take a Medicare supplement plan. So this is very important to understand as well, because especially in rural folks, remember we're talking to rural folks, to be able to go where you want to go and is a key thing.
And plus, you're not restricted just to your area.
Right.
You can travel. You can go to Arizona, New Mexico, wherever you want to go in the wintertime, leave the rainy season. You're still going to have coverage as long as the doctor takes Medicare.
Yeah. And for those that are having hip surgeries or knee surgeries, to be able to go to, if you want to go to Denver, if you want to go to the best that you need to go to, or you need to have that cancer treatment, we talked about this on a program here some weeks ago, the Mayo Clinic not taking Medicare Advantage plans. This is a big deal not to have those networks. Lastly, they don't want to hassle every year with this coverage. So our folks on Medicare supplements, they don't have to hassle along the way. It's a big deal as we grow older not to have a hassle, but it's just a matter of fitting it into our budget. So step one is, if you reach out to a personal agent along the way, it's always good to review plans, review the health that you have. It's very important to understand the health, because there's different plans. Like I had a guy in the office this last week, and he's overpaying heavily for a plan. It's a very good plan. It's a Plan G of all things. But we talked about another plan that's going to be much more affordable. It's still going to give him all the freedom, but there'll be a little bit more financial exposure on the front end, but I'm good with that. So then we look at different carriers. This is not exhaustive carrier list there as well. But folks, if you are in a situation where you're wanting to get back to Medicare, it'll happen. But to get on a Medigap plan, you may have to go into a simple underwriting situations. And so we wanted to put some of these questions up here. In the past 90 days, we admit as an inpatient. That's just a question that may come up if we're looking at an application for a Medicare supplement plan, or you've been treated in a nursing facility. Number 3, this is a big one. Has a medical professional told you that you have end-stage renal disease or require dialysis? So these are really knockout questions. Most people can do this. This one gentleman in the last 2 years, has a medical professional told you they may need any of the following: inpatient hospital admission, joint replacement, organ transplant, surgery for cancer, back spine surgery, heart vascular surgery. So these are not end-all be-alls, but we're just wanting to put a sample of what we call knockout questions, and we can go over that in a phone call just to find out if that works. Leith, you got anything on this before we jump to the next set of questions?
No, I think that's pretty clear. Yeah.
Okay. So then again, in the past 2 years, we're always looking at last 2 years. Have you been diagnosed, treated, advised for atrial fibrillation, flutter, artery vein, peripheral vascular disease? These are big, heavy things that Medicare supplement plans aren't necessarily going to want to bring somebody on if they're doing these things. So they're really looking at the last 2 years. And I've had this last one here. Within the past 2 years, have you had a heart attack, stroke, TIA, mini stroke? And there's people that get hit with something like this and they go, oh my goodness, this just happened. Now it's a little too late to get on a Medicare supplement plan. So recognize the fact that if you can't automatically get on a Medicare supplement plan, realize these are just a few questions that if we had a phone call together, Leith had a phone call with you, we would go over these together.
And I think that's why it's really important when you're first turning 65 to look at these plans and talk with an agent and try and plan out your strategy. Because if you just call the 1-800 and sign up for a Med Advantage because it's a zero premium, you've shot yourself in the foot if you wanted to get on a Medicare supplement plan at a later date.
And you and I have worked in the business long enough, Leith. No one wants to have a plan as bad as they do when they've been diagnosed with something.
Right.
Now they really want the plan because they realize they didn't plan ahead.
Yes.
So let's go back to our questions. So moving on here, then we should apply to a Medigap plan. Approval comes within days, right? We find out in a few days during this time of year right now. If we send something in for approval for a Medigap plan, we want to find out an approval. And by the way, every state is different. No matter what state you live in, if you're living in Washington, live in Oregon, Idaho, or any other state, premiums are just going to be different. So we can't go into premiums here, but we're always trying to make things affordable. If we get approved for a Medicare supplement plan, then we want to go look and apply for a Part D. And I talk about this because there's a lot of Part Ds out there that are zero premium, very little premium. For next year, it's going to be really looking good. So we would go ahead and get a Part D plan set in place, and that you get the card back in short order. Again, you have to do this before December 7th. So this is how we build our house of healthcare. We have our Medicare A and B in the dark blue, and then we tack on a Part D card for on top of that. But our really heavy lifting is being done with that Medigap plan. Again, not a Medicare Advantage, but a Medicare supplement plan from an insurance company. It's guaranteed renewable. It keeps going on. This is the time of year a lot of people can do that. And then, of course, custodial care is the foundation. We're going to talk about that later. That's the care. That's the type of care, actually, that is really, a lot of people are spending a lot of money on that stuff. Care at home, care at facility, because Medicare doesn't pay for it. And so I just want to go back to this slide right here is right now is the time that you can move out of a Medicare Advantage plan into a Medicare supplement if it works for you. And that would be number 2 here. You'd be switching back to original Medicare. So I hope that helps lay things out. Whoops, it looks like my camera's frozen. Does that bring everything together for you, Leith?
Yeah, I think you've covered it really good.
The whole house of healthcare that we do. Tell us about this story. You're talking about this story, some gal. Tell us about that story. We always hear lots of stories.
On the last couple of podcasts, we've talked about and mentioned, if you want to call 1-800 number, maybe not such a good idea, call an agent. This kind of relates to that. I had a client who she's been on a good group Med Advantage plan from her employer. And she's elderly and she gets mail and she gets phone calls, and she saw a thing on the TV that said, you have to have Part C. If you haven't signed up for Part C, you've got to call this number. So she called the number, and it was a 1-800 number, and they signed her up for a Med Advantage plan. She was already on a Med Advantage plan. They didn't ask her what type of plan she was on. Was it an individual or a group or whatever? They just told her that they had something that was much better than what she had and could get her on the plan. The problem with that is her coverage was through a previous employer. It was through a retirement plan. And so as soon as she signed up for that plan on the 1-800 number, she got taken off her group plan with her retirement benefits, and they took her off everything. And then we had to call the employer, try to get her reinstated, explain what happened, get her reinstated. And then it was a mess. It was a mess. So my moral to the story is that I'm not bashing the agents that write you on these 1-800 numbers. They're there to write business, and they may not know what your current coverage is. And a lot of, we all get older, maybe you don't remember what your coverage is, or you don't think about telling them what your coverage is. She could have, if we hadn't have caught it and got it done right away, she could have lost really good coverage for the remainder of the year. And so just be careful. Those ads come across TV or mailers or whatever.
Leith, that brings up a good point, because of the fact that many people today, they lean on me and they lean on you. They call you, right? They call us and they say, you know what, Mark, what did I have again? And that's important to have that conversation to go, oh, I know exactly what you have. No, you're not being told. And so I can't tell you the number of times that I've been able to divert a problem because someone's called and I said, that ain't right. That's not right. And so that's what's so important about relationships. And I think that's what you like as well, is that relationship.
Yeah. That's the reason I do this, is I just kind of like helping people out, because a lot of people don't get the right information.
Yeah, that's right. Hey folks, we are going to hit something of a great, interesting topic called IRMA. IRMA is a big deal now, starting to come up on our radar screen. It may not apply to you, but let's talk about it, because IRMA is something that is going to be a bigger factor in this. And so Leith brought this to my attention this morning. We were talking about this, and you know what? I said, you know what? It is time we start bringing this into the conversation. Now, you may not know what IRMA is, and if you're in a majority of people, but a minority of people are going to start getting hit with this as time goes on. So IRMA stands for Income Related Monthly Adjustment Amount. And what this means, folks, is that if you have a heavy, let's say you have good IRA money, et cetera, if you have good income that's coming in along the way, you may be taxed more than other people on your Medicare Part B and Part D premiums. You may end up paying more because of your income for individuals with higher income levels based on their tax return from 2 years prior. And this is important because people that are coming off of, they're working for Microsoft, they're working for Amazon, they're working for Google, they're working for executive jobs somewhere where they've been making good money, and now they want to get on Medicare. Medicare could be assessing additional charges. And let's go over a little bit about this here. These aren't exact numbers, but I'm hoping it's going to give you a little bit of understanding what this might be here. So we see here that for 2026, again, you'll have to consult with your own tax accountant or whatever on what your IRMA level is going to be. But this is something we believe is going to plague higher income earners in retirement. So your Part B premium, you might be paying $885, $184 and change or whatever it may be. If you are in a higher tax bracket, 109, 137, it could be variant on this. We were just saying you may have another $75 added every month. But then if you're in a higher bracket, 137 to 171 or so, you may have another $186, $187 added. And if you're making 171, 205, again, we have to look at the numbers directly. You may have another $300 involved. So recognize that this will apply to your Part B, and people are not being happy about this. They are not. It reminds me of riding on an airplane, right? And you thought you got a good deal on an airplane. Maybe you paid $700, $800 for a plane flight. On an international flight, maybe $1,000, and the person next to you is paying $300. It just irks you because you're in the same seat on the same flight and you're paying a premium for it. This is what's going to happen to people with higher income, couples particularly that have that higher income. They are going to be attacked. They're going to be attacked with a tax that's going to be called IRMA.
And plus, I think that I do it all the time. Somebody says, how much is that Part B? Oh, this year it's going up to 206. That's for the average, the average person out there. That's not for the high income earners. So if it's a high income earner that says that to me and I don't say, are you over X amount of dollars? I'm going to say, oh, well, it's $206 a month. And they're going to call me back and say, I'm getting billed a whole lot more.
Yep.
It can be a big deal for people.
Yeah.
And they can go back 2 years.
Yes.
And go back 2 years on their taxes.
And I've talked with agents we worked through this with clients, and maybe there's a reason why they shouldn't be, right? The income's up, but maybe there was a sale of a business or something. Maybe there's something there to say, you know what, is a one-time thing. It's not going to be consistent. Right. And so there may be something about that. So I think it's important to talk about this IRMA because of this fact that it's going to be affecting more people as we move on, and you have to tie in with personal agent. And this is what we do when we do income planning. We're looking at figuring out, is there something here that's going to affect your IRMA? Are you going to end up paying more than your fair share with regards to IRMA? A big deal. Anyway, that's about it for today. Happy Veterans Day, folks. We're recording this, and we wanted to talk about how to build that house of healthcare, how to avoid overpaying with the IRMA. Don't be like the lady that Leith was talking about that calls the 1-800 number and gets diverted down that section. Don't do that. I can't tell you, Leith, the number of times when someone I'm working with during this period of time decides to call an 800 number and totally gets diverted. And there has been times on December 6th or maybe the December 7th, right before the lane. No, we have to change it back. The deadline is right now. We can't go down this path. It's going to screw you up. And so
sometimes people think they can get a better deal.
Yeah.
That's just sure. I buy in a refrigerator. I try and find the best deal. To somebody's credit, they probably thought, I'm going to try and get a better than what Mark's telling me. And
yep. Surprise. I'll never forget it. There's a gal that switched off a Medicare supplement going on to Medicare Advantage. Oh, it's going to only be $30 a month instead of whatever, 100. I said, yeah, but the dialysis that you got going on ain't going to cover this stuff. So let's be careful. Let's be careful with what we do here.
It's all about being Yeah.
You know?
You just find somebody you like and you trust and have them help you out.
Absolutely. So, well, yeah. So we try to do this every Monday. We try to bring this out here. Monday mornings, we're trying to get something out. This morning, we're slipping a little bit, but make sure and subscribe to the channel. We're talking through all the Medicare stuff Leith and I are doing. And of course, if you want to hang out with us again, the hour later, we open up a Zoom TT65 office hour, TT65 office hour. We open that up 10 a.m. on Mondays to talk to anybody that wants to come in as well. Do we have anything else, Leith, to say hi to your friends and bring on?
No.
Say hi to your friends. Yeah, your friends. So
Come meet us next week, rather.
next week, we'll try to educate. We'll start talking about long-term care here along the way too. We're going to start bringing long-term care and dental and all that. So that's still coming. We're working on some of the details behind the scenes. All right, everybody. We'll see you out. Check out Leith's information down below. Learnwithleith.com is the calendar item, and you can talk to her and talk to me. We'll be happy to chat with things, and we will catch you next week.
Friends, we've reached the end of our 30-minute journey on Talking Turning 65. I hope today's conversation shed light on the challenges and opportunities you face as a rural retiree in the West. See how our Social Security income can be maximized. We know the struggles to create lifetime income. Seek to plan for tax-free income. Build Medicare planning that is affordable. Learn about long-term care planning that doesn't drain the savings accounts when a crisis happens. Have our wills and trusts current, so our family has our desires and not have the states make decisions. If you found value in today's show, please hit subscribe to our channel and share this program with a neighbor or friend. Together, we'll keep the conversation honest and helpful for years to come. Thanks for tuning in, and we'll see you next time on Talking Turning 65.